Hello everyone. So we are going to start our new session with some more questions. So let's start with the question number 51. A multi-gravid client admitted to the labor area is scheduled for a cesarean birth under spinal anesthesia. Which client statement indicates that teaching about the spinal anesthesia has been understood? So you have four options on the screen. What can be the right answer? Read all the options carefully and let me know the right one. So answer number 2 will be the correct one. The anesthesia may cause a severe headache which is treatable. So spinal anesthesia से हमको severe headache हो सकता है तो इसलिए हम epidural anesthesia को choose करते हैं over spinal anesthesia. So let's read the next question, that is 52. The nurse is conducting preoperative teaching for a client with gestational diabetes scheduled for a repeat cesarean. The clients tell the nurse that she has been taking ginkgo biloba to manage her blood sugar level. The nurse notifies the treatment healthcare provider because the herbal supplements put the client at risk of which complications? So read all the option carefully. What can be the right answer? So answer number 4 will be the correct one, that is prolonged bleeding. Because of ginkgo biloba, it acts as a थर्मोलाइसिस एजेंट जो कि हमको ब्लीडिंग के रिस्क पे डाल सकता है. So let's read the next question. The HCP determines that the fetus of a multiparous client in active labor is in distress, stating a caesarean birth with general anesthesia. Before the caesarean birth, the anesthesiologist prescribed cimetidine 300 mg per oral. The nurse explained that the purpose of giving cimetidine to decrease which factor? So you have four options. What can be the right answer? Why we use cimetidine? So the answer number 3 will be the correct one, to decrease the acid level of stomach contents. Now we are going to solve the question of the labor experience, that is 54. The nurse is performing a vaginal examination on a client in labor. The nurse finds that the fetal presentation part is 1 centimeter above the ischial spines. How would the nurse document this finding? So you have four options. What can be the right answer? So answer number 1 will be the correct one. Let's read the next question, that is 55. The nurse is managing a pregnant client's second stage of labor. The nurse should intervene when observing which action? Read all the options very carefully and let me know the right answer. So answer number 1 will be the correct, that is closed glotting pushing. 56th question. A client in the second stage of labor who planned an unmedicated birth in a severe pain because of fetus is in right occipital posterior position. The nurse should place the client in which position to relieve the pain? क्योंकि हमको posterior position में काफ़ी ज़्यादा pain होते तो which position will be best to relieve the pain? So answer number 3 will be the correct answer, that is hands and knees position. इससे क्या होगा? इससे जो fetus का head है वो away जाएगा sacral promontory से. इससे क्या होगा? रोटेशन हो जाएगी posterior से anterior position में, जिससे pain reduce हो जाएगा. Let's read the next question, 57. A woman who gave birth to her last infant by cesarean birth is admitted to the hospital at term with contraction every 5 minutes. The HCP intends to have her undergo a trial labor. Which does the nurse explain the client that trial labor means? हम क्यों ट्रायल लेबर करते हैं? Read all the option. What can be the right explanation of this? So answer number 3 will be the correct one. Labor progresses will be evaluated continuously to determine प्रोग्रेस फॉर विजाइनल बर्थ, ताकि हम पता लगा सकें कि विजाइनली डिलीवरी हो सकती है या नहीं, या फिर हमको अदर मीन्स की तरफ जाना पड़ेगा, सिजेरियन सेक्शन की तरफ जाना पड़ेगा. Let's read the next question 58. The nurse prepares the client for lumbar epidural anesthesia. Before anesthesia administration, the nurse instructs the client to assume which position? हम कौन सी पोजीशन में लंबर एपिड्यूरल एनेस्थीसिया देते हैं? So read all the option. What can be the right one? With sideline position or sitting position? Next question. The client in labor received an epidural for pain management. Before receiving the epidural, the client's BP was 124 by 76 mmHg. 10 minutes after receiving the epidural, the client's blood pressure is 98 by 56, that is low, and the mother is vomiting. Before calling the HCP, what should the nurse do? Read all the option carefully. What can be the right one? So answer number 2 will be the correct one. Turn the patient to her side. तो हमें क्यों करेंगे? To reduce the pressure on abdominal aorta and IV fluid rate को increase करेंगे, ना कि decrease. So let's read the next question. The nurse is caring for a woman G1PO 40-week gestation in active labor. Assessments include cervix 5 cm dilated, 90% effaced, station 0, cephalic presentation. FHR baseline is 135 beats per minute and decreases to 125 beats per minute shortly after onset of 5 uterine contractions and returns to baseline before the uterine contraction ends. Based on this assessment, what action should the nurse take first? So what can be the right one? So all this data shows early declarations. So that is normal. So इसलिए हम normally इसको document करेंगे और monitor करेंगे. No need to intervene. Now let's read the 61 question. The nurse is caring for a full-term, non-medicated primiparous client who is in transition state of labor. The client is writing in pain and saying, "Help me, help me." Her last vaginal exam 1 hour ago showed that she was 8 centimeter dilated plus 1 station and in what appeared to be comfortable position. She doesn't. What does the nurse anticipate as higher priority intervention in care of this client? Read all the options very carefully. What can be the right one? So as you all know, the transition phase is most difficult part of the labor process. तो client tired भी हो सकता है. So we have to examine the vagina ताकि हमको पता लगे कि कितने dilation हुई है, उसको push करने की need है या फिर नहीं. Let's read the next question 62. A client at 33 week of gestation is admitted in a preterm labor. She is giving betamethasone 12 mg IM every 24 hours. What is expected outcome of this drug therapy? So betamethasone का expected result क्या होगा? Read all the options. The neonate will be born with mature lungs. तो ये हम lungs maturity के लिए देते हैं. So answer number 4 will be the correct answer. Next question. A full-term client is admitted for induction of labor. The healthcare provider has assigned a biopsy score of 10. Which drug should the nurse anticipate administering to this client? So what can be the right answer? बायोसप स्कोर क्या इवेलुएट करता है कि सर्वाइकल कितना रेडी है लेबर के लिए बेस्ड ऑन 5 फैक्टर, दैट इज सर्वाइकल सॉफ्टनेस, सर्वाइकल effacement, dilation, fetal positioning and station. So what will be the correct one? अगर बायोसॉप स्कोर 10 है तो. So answer number 1 will be the correct. We have to administer oxytocin 30 units in 500 ml D5. Now let's read the next question. 64. The HCP has performed an amniotomy on a laboring client. Which details must be included in documentation of this procedure? It's a SATA question. You have to select more than one option. So read the question and options carefully. What can be the answers? So what can we include in documentation? Time of rupture, color and clarity of the fluid, fetal heart rate patterns, and order and amount of fluid. Let's read the next question. Following an epidural and placement of internal monitors, a client's labor is augmented with oxytocin. Contractions are lasting more than 90 seconds and occurring within 1.5 minutes. The uterine resting tone is more than 20 mmHg with an abnormal fetal heart rate pattern. Which action should the nurse take first? Read all the options. What will be the right answer? So in this case, we can see the client is experiencing uterine hyperstimulation from oxytocin. तो हमारा first step क्या होगा? We have to turn off the oxytocin infusion. Let's read the next question. The nurse noticed repetitive late discoloration on the fetal heart rate monitor. What is the best initial action by the nurse for late discoloration? So read all the option carefully and let me know what can be the right one. So answer number 4 will be the correct one, that is reposition the client, apply oxygen and increase IV fluids. Now let's read the next question. What action does the nurse anticipate completing at the end of second stage of the labor before the delivery of the placenta and spontaneous vaginal birth of a newborn? It's a SATA question. You have to choose more than one option. So what can be the right answers? Answer number 1 will be the correct, assessing the APGAR scores. Then 4 will be the correct, drying the newborn. 5th and 6th will be the correct answer. Initiating skin to skin care, taking newborn vital signs. Now let's read the next one. As a nurse begins the shift on an obstetrical unit, there are several new admissions. The client with which condition would the candidate for induction? So कौन से कैंडिडेट का हम सबसे पहले इंडक्शन कराएंगे? Read the options carefully. So answer number 1 will be the correct, that is preeclampsia client. Preeclampsia के अंदर हमको सबसे पहले यही है कि एंड ऑफ प्रेगनेंसी हमको जल्दी से जल्दी करना चाहिए, इसको क्योर करने के लिए जल्दी से जल्दी हम डिलीवरी करा सकते हैं. बाकी ऑप्शंस में एक्टिव हर्पीस में, फेस प्रेजेंटेशन में, लेट डिस्कलरेशन में हम सिजेरियन सेक्शन की तरफ ही जाते हैं. सो द आंसर विल बी प्रीएक्लेम्पशिया. Now let's read the next question. 69. A nurse and a UAP are caring for a client in a labor and birth unit. Which task should the nurse assign to the UAP? You have 4 options on the screen. What will be the right delegation? Answer number 2 will be the correct one. Remove a fetal monitor and assist the client to the bathroom. Now next question. A laboring client smiled pleasantly at the nurse when asked simple questions. The client speaks only Mandarin and the interpreter is busy with an emergency situation. At her last vaginal examination, the client was 5 cm dilated, 100% effaced and at zero station. While working with the client, which response indicates the client may be approaching birth? सो लैंग्वेज सिमिलर नहीं है, हमारे पास इंटरप्रिटेटर भी नहीं है, तो हमको कैसे पता चलेगा कि बर्थ अप्रोच होने वाला है. So read all the option. What will be the right one? So answer number 3 will be the correct one. अगर हमको strips में दिखते the fetal monitor strip shows early discolorations. That means the mother is going to birth the baby. Now let's read the question that are related with the interpretal clients with risk factor. So intrapartal clients में क्या क्या risk हमको देखने को मिल सकते हैं. Let's read the 71 question. The client is admitted with a suspected abruptio placenta. The nurse should assess the client for which sign and symptoms. Select all that apply. हमको abruptio placenta के अंदर कौन कौन से symptoms देखने को मिलते हैं. Bleeding that is concealed or apparent. Answer number 1 will be the correct one. Abdominal rigidity and painful abdomen. Next question. A 39-year-old multi-gravid client at 39 week of gestation admitted to the hospital in active labor has been diagnosed with class 2 heart disease. Which measures will the nurse encourage to ensure cardiac emptying and adequate oxygenation during labor? You have 4 options. Choose the right one. So what can be the right answer? Answer number 3 will be the correct one. Remain in side-lying position with head elevated. इससे उसकी oxygen saturation improve होगी. So this will be the good option. Now let's read the next one. When developing the plan of care for a multi-gravid client with class 3 heart disease, the nurse should expect to assess the client frequently for which problem? So what can be the right answer? So tachycardia will be the right one. Next is 74th question. A primary gravid client at 39 week of gestation is admitted to the hospital for induction of labor. The HCP has prescribed prostaglandin E2 gel for the client. Before administering prostaglandin E2 gel to the client, the nurse should perform which action first? Assess the frequency of uterine contraction because we cannot proceed with prostaglandin if the patient is in contractions. Now, question number 75. A primary gravida near birth is experiencing a prolonged second stage of labor with the fetus suspected of weighing over 4 kg. Which intervention would be the most important? Read all the option and let me know the right one. So if the baby is overweight and the labor is prolonged, so उसको केस में क्या क्या चीज होने के chances हैं? That indicate shoulder dystocia at birth. So इसके लिए we have to perform the McRoberts maneuver. Now next question, a multi-gravid client is receiving oxytocin augmentation. When the client's cervix is dilated to 6 cm, her membrane ruptures spontaneously with a meconium-stained amniotic fluid. Which action should the nurse perform first? Read all the option and let me know the right one. सो मैक्यूनियम स्टेन एमनियोटिक फ्लूइड, इससे हमको क्या पता लगता है कि फीटस डिस्ट्रेस भी हो सकता है. सो उस कंडीशन में वी हैव टू असेस द fetal heart rate. Now next question, a primary gravid client who has had an prolonged labor but now is completely dilated has received epidural anesthesia. Which statement should the nurse include in teaching plan about pushing? Read all the options. What can be the right one? Answer number 3 will be the correct one. The client should urge to push with an open glottis. Now next question 78. The HCP determines that outlet forceps are needed to assist the birth of a primary gravid client in active labor with a large for gestational age fetus. The nurse understands that the fetus skull must be at which point before this procedure can take place. So at which position should the fetal skull? Answer number 3 will be the correct one. Now next question, the HCP prescribed an amnio infusion for a primary gravid client at term who is diagnosed with oligohydramnios जिसके अंदर amniotic fluid का level कम हो जाता है. What does the nurse explain is primary purpose of this procedure to the client? Read all the option and let me know the right answer. Decrease the frequency and severity of variable discoloration will be the right one. So it is the purpose of this procedure. Now let's read the next question 18th. The nurse is admitting a primary gravid client at 37 weeks of gestation who has been diagnosed with preeclampsia to the labor and birth area. Which client care room is most appropriate for the client? So पेशेंट को प्रीक्लेम्शिया है तो उसको चांसेस हैं कि उसको सीजर्स भी आ सकते हैं. So what will be the correct one? आंसर नंबर 4 विल बी द करेक्ट. हमको उसको लोवेस्ट स्टिमुलाई प्रोवाइड करनी है. ज़्यादा स्टिमुलाई प्रोवाइड करेंगे तो पेशेंट को और ज़्यादा डिस्कम्फर्ट होगा. तो सीजर से प्रिवेंट करने के लिए और पेशेंट को कंफर्ट प्रोवाइड करने के लिए वी हैव टू मेक श्योर अ डार्क प्राइवेट रूम एज क्लोज टू नर्सिंग स्टेशन एज पॉसिबल. Now let's read the next one. A multi-gravid client is admitted to the labor area from emergency department. At the time of admission, the fetal head is crowning. At the client tells the baby is coming. To the client, remain calm and cooperative during the main birth. Which response by the nurse will be appropriate? Read all the options. What will be the right one? Answer number 4 will be the correct. I'll explain what is happening to guide you as we go along. Next question. The nurse is caring for a multi-gravid client and observe the woman squatting on the bed and the fetus head crowning. After calling for assistance and helping the client lie down, the nurse should perform which action next? Read all the options. You have 4 options and choose the correct answer. Provide the gentle support to the fetal head will be the correct one. Now next question, that is 83. During the first hour after a precipitous birth, the nurse should monitor a multiparous client for the sign and symptom of which complication? So what can be the right answer? You have 4 options. क्योंकि यहाँ पे प्रेसिपिटस बर्थ का केस है जिसके अंदर रैपिडली लेबर होता है, क्विकली बर्थ कैनाल से बेबी जाएगा, तो मेजर कॉम्प्लिकेशन इस टाइम पर क्या आ सकती है? दैट इज बोगी यूट्रस और यूट्राइन एटोनी, टोन यूट्रस की डिस्टर्ब हो जाएगी. Now next question 84. A multi-gravid client in the labor at 38 weeks of gestation has been diagnosed with RH sensitization and probable fetal hydrops and anemia. Which fetal heart rate pattern would the nurse find most concerning? Which will be the most concerning? So read all the option and let me know the right one. So answer number 2 will be the correct one, that is sinusoidal pattern, जो कि क्या reflect करता है? It reflects an absence of autonomic nervous control over the fetus heart rate, resulting from severe hypoxia. वैसे तो ये रेयर होते हैं, बट ये काफ़ी डेंजरस हो सकते हैं. इसके लिए फिर हमको सिजेरियन सेक्शन करना पड़ता है. नाउ नेक्स्ट क्वेश्चन 85. The nurse in the labor and birth area received a telephonic call from an emergency department announcing that the multi-gravid client in active labor is being transferred to the labor area. The client has no prenatal care. When the client arrives by the stretcher says, I think the baby is coming, help. The nurse skull is crowning. The fetal skull is crowning. The nurse should obtain which information first? अभी टेलीफोनिक कॉल है, हमारे पास डायरेक्टली जो पेशेंट है वो नहीं है. सो व्हाट कैन बी द राइट वन? सो प्रायोरिटी असेसमेंट क्या होगा? टू डिटरमाइन एस्टिमेटेड डेट ऑफ बर्थ एंड गेस्टेशनल एज ऑफ द fetus. So answer number 1 will be the correct one. Let's read the 86th question. A primary gravid client at 41 weeks of gestation is admitted to the hospital's labor and birth unit in active labor. After 25 hours of labor with membranous rupture for 24 hours, the client gives the birth to a healthy neonate vaginally with a midline episiotomy. Which problem should the nurse identify as priority of this client? So क्या चीज के रिस्क पे पेशेंट हो सकता है? Read all the option carefully. What can be the right answer? Answer number 4, that is risk of infection, will be the correct one. The nurse is caring for a primiparous client and her neonate immediately after birth. The neonate was born at 41 weeks of gestation and weighed. Assessing for the sign and symptom of which condition would be the priority at this time? Read all the options. What can be the right one? 41 weeks मतलब पोस्ट टर्म बेबी है, तो पोस्ट टर्म बेबीज को कौन सी कंडीशन होने के चांसेस है? That will be hypoglycemia. Now next question 88. A multi-gravid client in active labor at term diagnosed with polyhydramnios. The HCP has instructed the client about possible neonatal complication related to polyhydramnios. The nurse determines that the client has understood the instruction when the client state polyhydramnios is associated with which problem in the fetus or neonates. So polyhydramnios is associated with gastrointestinal disorders. That is tracheoesophageal fistula, etc. So answer number 4 will be the correct one. Now 89 question. A primary gravid client at 39 week of gestation is admitted to the hospital in active labor. On admission, the client's cervix is 6 centimeter dilated. After 2 hours of active labor, the client's cervix is still dilated at 6 centimeter. After 2 hours, the dilation is still the same with 100% effacement and positive one station. The contraction are 3 to 5 minutes apart, lasting 45 seconds and moderate intensity. The nurse should determine the client is most likely to experiencing which problem. Read all the option. What can be the right answer? Cephalopelvic disproportion will be the right answer because there is no change in the cervix dilation for 2 hours. तो हमको क्या सस्पेक्ट हो सकता है कि पेशेंट को cephalopelvic disproportion है. Now 90th question. The HCP who elects to perform a cesarean birth on a primary gravid client for the fetal distress has informed the client possible risk during the procedures. When the nurse asks the client to sign the consent form, the client's husband says, I will sign it for her. She is too upset by what is happening to make this decision. What should the nurse do? So you have 4 options. What will be the right answer? So क्या हम consent उनके husband से sign करा सकते हैं या फिर नहीं? आंसर नंबर 3 विल बी द करेक्ट वन. आस्क द क्लाइंट टू साइन द कंसेंट. हमको क्लाइंट से ही साइन करवाना है. अगर वो साइन कर सकते हैं तो किसी इमरजेंसी के अंदर इफ द क्लाइंट इज नॉट एबल टू साइन द कंसेंट, तब हम उनके फैमिली मेंबर से कंसेंट साइन करा सकते हैं. नाउ नेक्स्ट क्वेश्चन दैट इज 91. A multi-gravid client at term is admitted to the hospital for a trial labor with possible vaginal birth. She has an history of previous cesarean birth because of fetal distress. When the client is 4 centimeter dilated, she received nulbipin intravenously. While monitoring the fetal heart rate, the nurse observed minimal variability at the rate of 120 beats per minute. The nurse should explain the client that decreased variability is most likely caused by which factor. So, what will be the right answer? You have four options. What can be the right cause? अफेक्ट ऑफ एनाल्जेसिक मेडिकेशन. वैसे तो बहुत सारी कंडीशन के अंदर ये हो सकता है, बट ये एनाल्जेसिया मेडिकेशन से होता है. 92 क्वेश्चन. ड्यूरिंग अ scheduled cesarean birth of a primary gravid client with a fetus at 39 week of gestation in breech presentation, a neonatologist is present in operating room. The nurse explained to the client that the neonatologist is present because neonates born by cesarean birth tend to have increased incidence of which problem. So you have four options. Neonates by cesarean section को कौन सी complication होने की, कौन सी risk पे होते हैं. So what can be the right one? Respiratory distress syndrome will be the right answer. Now next question, 93rd. A 28-year-old multi-gravid client at 28 week of gestation diagnosed with acute pyelonephritis is receiving IV fluids and antibiotics. After teaching the client about the rationale for aggressive therapy, the nurse determines that the client's further instruction when she says acute pyelonephritis can lead to which complication. So read all the option. किस कंडीशन में उनको फर्दर टीचिंग की रिक्वायरमेंट हो सकती है? द क्लाइंट सेज इट कॉज कंजेनाइटल फीटल एबनॉर्मलिटीज विल बी द करेक्ट वन. Now next question. A primary gravid client at 38 week of gestation is admitted to the labor suite in an active labor. The client's physical assessment reveals a clydomidal infection. The nurse explained that if the infection is left untreated, the neonate may develop which problem? क्या प्रॉब्लम हो सकती है? रीड ऑल द ऑप्शन. व्हाट विल बी द राइट आंसर? कंजक्टिवाइटिस विल बी द राइट ऑप्शन. Now next question, that is 95. A 34-year-old primary gravid client at 39 week of gestation admitted to the hospital in active labor has BRH negative blood. The nurse should instruct the client that if the neonate is RH positive, the client will receive an RH immunoglobulin injection. For which reason? So किस लिए हम इंजेक्शन देते हैं? Choose the right answer. To prevent the RH positive sensitization with next pregnancy, ताकि नेक्स्ट प्रेगनेंसी में बच्चे को हार्म ना हो अगर वो RH पॉजिटिव है तो. 96 question. A 16-year-old primary gravid client admitted at 38 week of gestation with severe preeclampsia is giving intravenous magnesium sulfate and ringer lactate solution. The nurse should obtain which information? Choose the right answer. Magnesium sulfate is a CNS depressant. So उससे क्या होगा? रेस्पिरेटरी डिस्ट्रेस भी हो सकता है. तो वी हैव टू, priority हमारी क्या होगी? वी हैव टू मॉनिटर द रेस्पिरेटरी रेट एवरी आवर्ली. Now next question. The nurse has received a telephonic call from emergency department indicating that the multi-gravid client is early labor and diagnosed with probable placenta previa will be arriving soon. What is the priority intervention when the client arrives at unit? So placenta previa का केस है. So patient hypertension में जा सकता है. So we have to continuously monitor the blood pressure. Now next question 98. During admission, a multigravida in early active labor acts somewhat euphoric and tells the nurse that she smoked some crack cocaine. Before coming to the hospital, in addition to fetal heart rate assessment, the nurse should monitor the client for symptoms of which complications? That is abruptio placentae. Now next question. A primary gravida in early labor with abruptio placenta develops DIC. Which agent should the nurse expect the HCP will prescribe? So DIC के अंदर हम क्या चीज देते हैं? That is, what will be the right one? Fresh frozen platelets will be the correct answer. Now last question, that is 100. A multi-gravid client diagnosed with chronic hypertension is now preterm labor at 32-week gestation. The HCP has prescribed magnesium sulfate at 3 gram per hour. Which assessment findings indicate the intended therapeutic effect occurs? तो मैग्नीशियम सल्फेट से हमको क्या थेरेपेटिक इफेक्ट देखने को मिलेगा? So magnesium sulfate may be used as anticonvulsive or a tocolytic agent. So what will be the right answer? The intended effect of client is to decrease the number and frequency of contractions will be the correct one. So answer number 2 will be the correct one. So this was all about today's session, and we are going to discuss some more questions in our next session.